I'll just let you know what the format is this afternoon. I have a couple PowerPoints, and the first one, I know we talked on some of the issues that affect prisoners, but I know it's UK based, but although a lot of it is based from England and Northern Ireland, I think the issues are universal. The same issues affect all prisoners. It's not that long, but we'll go through them because I think you need to consider these when you're teaching in prison. Then I have a short lesson on how to make an effective lesson plan. And then we're going to do a practical activity in groups. Okay? So Louis Appleby had a good quote, and it was that prison can be an unhealthy place. Prone to depression, suicide, hepatitis C, and the heart and lung diseases that are caused by smoking. And I thought that was a good quote, because if you don't go into prison unhealthy, the chances are at some stage you are going to. The chances of you becoming unhealthy, either physically or mentally, are quite great. So consequences to the pressures of prison. When you go to prison, you often feel frightened and disoriented. You may feel physically threatened, having increased defensive psychological operationalizations, which means denial, detachment, for example. Intensified sense of loss or alienation. I'm sure we've all worked with prisoners that little things happen to them, but they become huge things, and that is often a result of being in prison and having lack of control, and often prisoners are not able to cope with everyday issues they'd be able to cope with on the outside. There's an increased tendency towards egocentric behavior, so it's about the prisoner. Increase in psychiatric morbidity, so the incidence of both physical and psychological deterioration as a result of mental or psychological condition. Often prisoners will develop illnesses. There are theories that say this could be a result of, in a prisoner's dysfunctional life, in early childhood and on the outside, the only time they experienced attention was when they were sick, or when they had a tragedy or an incident. And so they have inappropriate ways of getting attention, so they manifest illnesses because they're craving the attention and they want somebody to look after them. Have you experienced that here? Some prisoners, unfortunately, commit suicide or attempt suicide, and there's a potential for re-traumatization. So if you imagine a prisoner getting even arrested, they're getting arrested as a result of a crime they committed, and at times it can be a violent crime, and prisoners would often have post-traumatic stress disorder as a result of that, but also sometimes the conditions of their arrest are very traumatic. But there's very positive factors relating to being put into prison. often talk about people getting sent to prison because it protects society, but sometimes prisoners' lives are improved. There's a cessation of destructive and self-defeating behaviors, time away from others who influence criminal activity. So if you're involved in a gang or negative peer pressure, you're away from those influences. Abstinence from drugs and alcohol. Treatment and diagnosis of mental health and physical conditions. It still always amazes me the amount of prisoners who come into prison and they're not aware that they have schizophrenia, or they're not aware that they have bipolar or manic depression. And I suppose if you're always in a group of people that are always on drugs, your inappropriate behavior or the behaviors and the psychosis caused by mental health conditions is very similar to the behavior of somebody who is on hallucinogenics or is on crack and cocaine and things like that. So there's an opportunity for self-reflection and self-improvement in prison. There's stability and routine and structure, and I think many prisoners have come from families and social situations without boundaries and without structure. In prison, and this is where I think we come in, there's a huge opportunity to build life skills and improve education. Now this is for Northern Ireland, and I'd be interested to hear if it's any different for Lithuania. But the typical prisoner in Northern Ireland is young, unemployed, and unattached. So not married, not in a relationship, a meaningful relationship. They have, and this is a psychology term, hostile attribution bias and external attribution of blame. So they always feel like they're the victim. They use this as an excuse, and the excuse of how others treat them as justification for their criminal behavior. So I've had prisoners say to me, "Oh, sure, but it's just the way it is where I live." And, well, you know, the paramilitary shot at my house when I was a baby, and they made us move, and that's why I'm a criminal. So it's never reflecting accurately on the consequences of their behavior. It's finding a blame, an external blame. And that's failure to take responsibility. They often have alcohol and substance abuse issues, dysmorphic symptoms, so just being depressed, or even if they're not clinically depressed, very negative with a low mood. Poor personal resources. They're very resourceful if they're trying to break into a house, very resourceful if they're trying to get drugs, but have a hard time solving life issue problems. Prisoners tend to have poor insight and very low levels of motivation or a commitment to change. Now, I work with prisoners who tell me the last time they're going to be in prison, they're going to get out, they're not going to hang out with friends that are doing drugs, they're not going to drink because they know it's alcohol that leads to other destructive behaviors. But in order to do that, it means they need to find other activities, and they're not often committed unless you hold their hand, you know, to go and attend meetings or seek therapy or engage in learning or even volunteering or employment. How different is a Northern Ireland prisoner or a Northern Irish prisoner to a Lithuanian prisoner? Are those similar? Yeah. And would your prisoners have a huge alcohol, issues with alcohol and drugs? Yeah. And literacy, illiterate and poor written skills? Yes. I think it's universal. I put in statistics, and I'm aware that these are from where I come from, but I thought it's quite interesting. 25%, and this is universally, 25% of the general population in the Western world will experience depression at some stage of their lives. But for prisoners, it's more than 70%. So it's quite high compared to general population. So more than 70% of prison population have 2 or more mental health disorders. So comorbidity. So they may have clinical depression and a personality disorder. Personality disorders are very, it's a new thing that we're focusing on in prisons. Do you look at antisocial personality disorders and histrionic personality disorders and antisocial or borderline? Is that something it's kind of a new buzz thing in the UK? And it's hard to get statistics because often the prison service does not want to label somebody as having a personality disorder because there's theories that there's no cure, but also treatment for personality disorder is very, very expensive, and there aren't a lot of treatment centers. And there's still, it's about money. Do you want to invest that much money in a prisoner when we believe there isn't a huge cure rate or rehabilitation rate? There's also a belief that it's a behavioral issue rather than personality disorder. They feel is a behavioral issue that's a result from post-traumatic stress disorder and a traumatic event that is experienced in early childhood. And it's a very complicated disorder. And if you look at many prisoners, there are few that haven't experienced post-traumatic stress disorders or traumatic events in early childhood. Male prisoners are 14 times more likely to have 2 or more disorders than men in general. And female prisoners, even though there's fewer females with mental health issues than male, of the female prisoners, they are 35 times more likely than women in general to have mental health issues. So some people interpret that as there aren't as many female prisoners, but the female prisoners that commit crimes and are put, caught and sentenced, they have more complex mental health needs. And that statistic is interesting if you apply it to education, because female prisoners also have lower literacy and numeracy, so they're not able to read and write and calculate maths. They have lower rates than male prisoners. And so it's hard to know whether society rehabilitates women better and caters to women's needs better, or females' needs better, so there's fewer women that offend. But the ones that offend in the female population have higher incidence of complex mental health issues, and they have very low levels of literacy and numeracy and computer skills. And I find that quite interesting when you look at the split between sexes. The suicide rate in prisons is about 15% higher, 15 times higher than in the general population. I'm not going to go too much in this, but in Maghaberry Prison, which is Northern Ireland's maximum security prison, there are about 1,000 prisoners. There's 800 new referrals to the mental health team annually. So it shows like almost all the prisoners would have some sort of a mental health concern. 25% of the prisoners that are referred have a formal diagnosis, which means 75% didn't know or hadn't been treated or hadn't been diagnosed for any mental health issue. And 75% of prisoners have personality disorder. But you can also have personality disorder with another disorder. You can be bipolar, schizophrenic, clinically depressed, and have a personality disorder. So quite complex, which is all the more reason for art and therapeutic interventions in prison, I believe. Are you okay with what a personality disorder? There's certain traits that are very common for personality disorders, and I imagine in Lithuania you would have the same history of childhood deprivation and abuse, dysfunctional families, criminality, and paramilitarism. Now that's very common specifically to Northern Ireland because of the sectarian violence and the political organizations of republicanism and loyalists. Exposure to violent role models, punishment beatings, shootings for antisocial activities. That would also be very common in Northern Ireland. A lot of prisoners would have had their kneecaps shot or shot in the backs of the legs or their hands. And that's if a youth starts getting disruptive and committing crimes within a community. A lot of times if there's a high rate of paramilitary in the area, they do not want to draw attention to their own activities, and they do not want the police around, so they take care of it by themselves by shooting as punishment, which is horrific and traumatic. There's a use of instrumental violence for their own benefit, interpersonal alienation, abuse of drugs and alcohol, non-compliance with therapeutic interventions. So if they're referred to counseling, they won't show up. Or if they need medication, antipsychotics, not that medication's the be and all, but if they're prescribed an antipsychotic, often they won't take it, or they won't take it properly. External attribution of blame, so it's always somebody else's fault. And they look at the statutory services as agents of social control. So the police, the doctors, teachers, even ambulance, fire service, not as service people who can help them. They're the bad people that are trying to control them. I think we can think of obvious consequences of personality disorder, but I just found that really it's dysfunctional families, family disharmony, school dropout, so not attending school. If they have employment, they're also the type of people that just walk out of a job. You know, if they're criticized by their employer, they just say forget it and they leave, or they don't show up at work, so they get fired. Hazardous lifestyle, so they don't worry about the consequences of sniffing a whole bag of cocaine at once, or sniffing glue, or driving very, very quickly without a license, or jumping off buildings. Mental and physical ill health, health issues, more prone to suicide, impulsive and aggressive behaviors, self-harm, and that is a huge issue in UK prisons, people cutting themselves, and they've learned, it's quite clever in their mind, it's how they cope. It's a coping mechanism, and it allows them, in the past, they've learned that that's how they cope when they're in very negative situations, or situations where it wasn't a safe enough place to verbalize issues and concerns. But unfortunately, it's not the most appropriate way of coping, and it's quite addictive. There's a lot of substance misuse and criminal activity. And do those sound familiar to the prisoners you deal with? And that's, if you want, I could email this to you, but just there's some academic papers where, if you were interested, you could read more. Now, I'm working with a prisoner from Lithuania right now, and he told me that there's the large prison in the city centre. Is that a maximum security prison in Vilnius?
One person. The others we call as penitentiary institutions.
Right, so it's moderate.
In Vilnius, they make
Right.
it.
Okay.
I think it is. It is maximum. Do you have category elements?
No,
Do you-
we don't categorize like high security, low security. We have remand prisons like detention centers. Then we have one prison together with the remand prison that is English.
That's not prison in our language.
No. It's a penitentiary.
Yes.
Because with our terminology, they're all prisons, but they're categorized. That's what I just wasn't sure of. Okay.
So we have categorized in just, we say prison, it's one word in Lithuanian language.
Yes.
Not so strong, but they have another words. But they also
Residential houses, we have another category.
Right. Okay. And so prisoners don't move from one prison. They just, if you're in, when you stay there, obviously there's the remand center, but when you're sentenced, then you go to another prison. Yes.
Yes.
And then, are there female prisons and male prisons, or is it all together?
No.
No
We
separate?
have one female prison,
Uh-huh.
residential institution, and also for juveniles we have some.
Yes, separate. Okay. So it's not that different. I don't want to talk too much, because I'd rather you do a bit of a activity. Oops. This is the problem, having one big PowerPoint. Okay, there. From current slide. What I want to do is explain, how many of you have done teacher training previously? Are there any teachers for
arts teacher in arts.
Attorney General.
Just general teaching,
General teacher training.
just any teaching
Kiek
course.
iš jūsų šiuo metu yra pabaigusi kažkokį tai mokymą?
Bet kokį
Bet kokį. Tiesiog pedagogika, čia pats esate pabaigę. Yeah, social pedagogues and these all the social pedagogues and so yeah.
Right, so I'm sure it's similar, and you've probably looked at like the 5 areas of a lesson. But what I'm going to do, because it's considered good teaching practice to have, and I'm sure you have it here, called a lesson plan, and it's almost like an agenda for what you're doing. Do you do that here? Did you learn about it? Just every time you go into a classroom in the UK, they consider it's a good idea to have a written document that explains in different steps what you are going to teach in the class. I'm just going to close that out. That's okay. What you're going to teach. And that's okay. Some of the artists that work within prisons in Northern Ireland don't come from a professional teaching background. They are artists that deliver workshops. And there's nothing wrong with that, but the Cred Ability course is trying to help you to reflect on your practice and become a better teacher. You know, the reason you want to have a lesson plan, especially, is because if you have a whole bunch of different students in different classes, it's difficult to remember what every prisoner is working on, or every student's working on. And if you can't remember what you've done, or you can't remember clearly what you've done, you could miss out on parts of their education. But it's also more difficult to reflect on whether it was successful or not successful. And when I taught this in Northern Ireland, a lot of the artists complained and said, oh, it's just paperwork. And anybody who's done social work or other jobs, there is a lot of paperwork. But I do ultimately think it makes your job easier. So your lesson is broken up. I'm wondering if I can write on this. It's broken up into 5 sections. And the first thing you want to do when you're teaching, whether it's at university or prison or in school, you want to have a warm-up activity. And it's the same if you were playing the flute. Often you don't just go and start playing in a concert. You would practice and warm up, or if you were a singer, you'd warm up your voice. Or if you played football, you'd run around and stuff. And it focuses you on the task. It's the same as students. It's unrealistic to expect that they're going to be alert and ready to learn instantly. So you get your students to start thinking about what you may have talked about the last time you saw them. You may have given them something to work on during the week. So you might want to look at their work, or look at their drawing, or just discuss. But I think mentally, just as a relationship, it helps to build a rapport, and it makes the prisoner think that they're important, or the student to realize they're not just a number. I think in prison so often, all the prisoners are treated the same way. And so if you're teaching them, and you remember what you talked to them about the previous class, first of all, they're reminded of what they learned, but it makes them feel individual, and it makes them feel builds a little bit of self-esteem, it makes them feel individual. And they have found that just doing that simple thing that might you only take 15 seconds can enhance somebody's learning and and also their behavior. This activity, your warm-up, your start activity, is tiny, just a tiny portion of your lesson. Then generally what you do is something called your introduction. So it's, today I thought we'd look at this, or would you be interested in learning how to use watercolor? I found a computer program that I thought you might enjoy looking at, so that the learner understands what's going to occur. This is important, especially when individuals have Asperger's syndrome or autism. Often they become anxious if they don't know what the format is. And you may not be aware that somebody is anxious, but it's such a simple thing to avoid this and put people at ease and make them feel comfortable. So this is the part of the lesson when the teacher does a lot of the talking. It's teacher-led. The students can be involved if you just sit there and ask them questions. So for instance, if I came in and I said, today I want to use watercolor. Do you remember that artist we looked at 2 weeks ago that did the really colorful watercolors and they were from France? Who was that artist? It can be as simple as that. It piques their memory and it gets the students involved. Depending on how complex the topic is or how much new vocabulary, new terms and words there are, it sometimes can take up, a bit more time. It might take up twice as long as your introduction. The next part is student-led. It's the practice. It's where you either have students working one individually or in pairs. They might be doing the activity. They might be practicing the paint, filling in a worksheet, reading a story. You might get them to fill in some answers referring to the demonstration, the little demonstration you did. So it's almost like they're testing out the new technique you gave them. So you did your warm-up where you're greeting them, making them feel special. Then you introduce, which is explaining what you're going to be doing. Then you demonstrate what you're doing. You get them to practice it. So maybe you have a demo on how to use the potter's wheel using clay. You get everybody to just do a little bit on your piece that you demonstrated. And then this is the biggest section. It's where you actually get them to use those new skills to make something, or to write something, or to do something, do an activity. This is usually an individual activity, but if it's pair, joined up learning, or group work, they work together. And that's usually what they do for the rest of the session. Now you may follow that up with a review. And a review might just be, so did you enjoy that activity? What did you find difficult? Or you might just have a little 5-minute review where you're asking them questions. But often I think in prisons we're very informal. And so it might even just be, oh, that was really good, your work looks great. Next week, would you like to continue with this? But again, it's almost similar to the warm-up. It's like the warm-down. One thing I'm going to say is, do you know how long each activity should be in general? There's a formula in psychology that we would use, and it's the person's age. Do you know it? It's the person's age plus 2. So if you were working with a 10-year-old student, you would take their age, which is 10, you'd add 2 to it. So each activity, or in education we call them learning episodes, should be no longer than 12 minutes. And you continue to do this up to the time of 20 minutes, because they find that it doesn't really matter how old somebody is. You can only do one activity solidly for 20 minutes. Now, factors that would affect this would be, doesn't matter how old the person is, if they're on drugs, if they have taken alcohol, if they're depressed, if they have a learning disability, if they're ill, the time decreases. And I'm sure that, I don't know, do you use Facebook here? You know, when you're on Facebook, or if you're working at a computer, do you ever find you're working away and then you start to get bored, or your mind starts drifting, and then you think, I'm going to see if anyone sent me an email. And you start looking at emails. And then you go back and then you think, oh yes, maybe I'll look and see if I can order a pair of shoes online. Then you go back. I think that even everybody, we discipline ourselves, and I think it's a very natural tendency. Other people may, work for a bit, then they go and make themselves a cup of tea, they drink the tea, they come back, then you do more work. And I think the biggest problem when people go into prisons is they expect their prisoners to do one activity for the whole hour and a half, 2-hour session. And then they get frustrated when the prisoner starts goofing around or becomes disruptive. And I think that we need to realize that it's okay to have them painting for an hour, but maybe they do 20 minutes of painting, then you go around and you talk to them about their paintings, or you get them to hold up and you comment on how well they're doing and offer suggestions. Then they do more painting for 20 minutes. Then maybe they have a cup of tea or coffee. Then they do more 20-minute sessions. And 20 minutes would be the maximum amount of time. And that's not even considering the fact that they probably have mental health issues, learning disabilities, physical or mental ill health. Okay? What I want to do